Hello everyone and welcome to our webcast Passport to International Patients. My name is Cristina Cardona and I am the Executive Global Program Manager for the Medical Tourism Association. Today we're going to be discussing the importance of training and certification for international hospitals, and we're very excited to present to you the training and certification program that the Medical Tourism Association has developed for international hospitals. I have also the pleasure to have with me two other presenters, Mary Miller, who is the Manager of Continuous Quality Improvement for the Medical Tourism Association, and Alejandro Gutierrez, who is the Marketing Manager for Sunny Dental Group, an organization that got certified in 2013. He is joining us from Mexico. So what are we going to cover today? We are going to discuss the importance of certification in the industry, and we will present to you the MTA Training and Certification Program for International Hospitals, which is called International Patient Services Certification. Mary Miller will discuss with you the best practices in international patient management and present to you in detail what are the standards of our program. We will present to you as well what is the value of our program, and we'll have an interview with Alejandro at the end. If you have any questions during the webcast, please type them in the Q&A section. We will be very happy to address these questions at the end of the webcast. So let's get started. I would like to spend a few minutes talking to you about who we are, who is the Medical Tourism Association. We are the global voice in the industry, and we are the only international trade association in the world. We work with government organizations, with hospitals around the world, employers, insurance companies, and any stakeholder in the industry. We have 300 members in 100 different countries and 15 regional offices distributed around the world. One of the greatest value that the Medical Tourism Association brings is our global distribution channels, and we promote our members through our various channels, including medicaltourism.com, who is our consumer site. This website is ranked #1 in Google searches on medical tourism, and it's translated into different languages. This is a website where consumers find all the information that they need with regards to different destinations, different procedures, comparison of prices, etc. Our Medical Tourism magazine is the official publication of the Medical Tourism Association, and we have 120,000 subscribers in 100 different countries. This is a printed and online publication that is both a B2B and B2C publication. And last but not least, we have our social networking site, which is medicaltourismcity.com. This is a platform for everyone who is interested in the industry. It is free for everyone to join, and it is a great platform for networking and collaboration. So what is the value that the association brings to all the stakeholders, and in particular to hospitals and clinics and healthcare providers from around the world? Well, because we've worked with all the stakeholders for many years, we have been able to tailor integrated solutions for every stakeholder. In particular, for hospitals, we can help hospitals in the research and industry analysis phase. I'm pretty sure that most of you on the line have or are thinking about conducting a feasibility study that will allow you to identify what are your advantages, what are your weaknesses, what are the opportunities and threats in the industry. This type of studies are very important to assess what are the target markets, what is the plan, the action plan that you need to follow in order to develop a sustainable medical tourism plan. Now, the MTA can also help you through the program development, and our training and certification program is under the umbrella of program development. But along the way, you have to make sure as a hospital that you develop a business and marketing strategy, and also you continuously brand your organization to enhance your international brand and to be able to attract more international patients. So let's focus today on the training and certification program. For those of you in the webcast that are connected from around the world that are represented different industries, also know that the Medical Tourism Association has developed training and certification programs for the hospitality industry as well as other supported industries such as airport, transportation, etc. So let's focus now on the importance of certification for international healthcare providers. So as a hospital, your goal and your priority is always going to be improving how care is delivered to your patients. And why is that? Because as we strive to achieve positive outcomes, we're going to increase patient satisfaction. This is going to reduce the time that patients stay in the hospital. It's going to reduce healthcare costs for your organization. And of course, it's going to increase productivity, profitability in the long run. Patient satisfaction is key for word of mouth referrals. And this is how your organization is going to build the brand, and it's how mostly you're going to attract international patients. Now, achieving a certification in the industry is going to provide a detailed and realistic roadmap for continuous improvement, and it's going to help your entire organization to strive for excellence. And more importantly, it's going to allow you to measure the performance with regards to quality of care and efficiency. You have to think about individuals who are looking to travel overseas for healthcare. These individuals are slightly different from the public, from the public population. It's an individual that has taken the time, most likely, to research the quality of care that is being offered in multiple hospitals. So international accreditation is going to be critical for patients to identify who is the best hospital, who is the hospital and the doctor that can guarantee that my patient experience is going to be outstanding, and that is going to take care of all the process from pre-travel to post-travel. So understand that certification is very important for patients as they are going to search and look for hospitals that have this kind of competitive advantage. Is now certification important for insurance companies and employers? Of course, absolutely. It is very important because the main concern of insurance companies is, does the healthcare provider overseas, does it have the credentials to provide adequate care? This is a critical question, and international accreditation is going to obviously allow these companies to find a stamp of credibility, to really make sure that the hospitals that are part of their network have that ability to provide the adequate care, have the obviously the processes in place to maintain a continuous patient care, not only during the surgery but also when they return home. So insurance companies like the ones you're seeing in the screen right now, international insurance companies like Aetna, Bupa, Cigna, United Healthcare, many of these insurance companies have already implemented medical tourism. And you want to make sure as a hospital that wants to attract international patients that you are a part of the global network of providers of these insurance companies. For those reasons, for both reasons, the first one is because you want to make sure that you attract international patients that are part of their insurance clientele. But also think about the expats that are living in your region. So if you're a hospital in Mexico or you're a hospital in the Middle East, wherever you're joining us from, you have to be part of this international insurance companies network, because that way you can attract the expatriates living also in your region. So let's go into details about our specific program that we have customized for international hospitals. It is called International Patient Services Certification, IPSC, and the focus of this program is to make sure that the hospital provides an outstanding patient experience, and to make sure that the hospital has the processes and the standards in place to make sure that the patient is taken care of, that the quality of healthcare that is provided is excellent, and the experience overall is excellent. So what are the main goals of this program? So we're going to increase patient satisfaction. As I mentioned before, as we increase patient satisfaction, we increase productivity, we reduce healthcare costs and liability for the hospitals, and in the long run, we increase profitability and more referrals that are going to result in increased revenue for the hospital. It is very important to brand your competency as a mark of excellence. So getting certified with our program is going to improve your reputation, is going to give you that stamp of credibility that patients and buyers of healthcare are looking for around the world. And of course, such a certification is going to set your organization apart and create a competitive advantage. So what are you going to accomplish? You know, obviously these are the main goals, but there are other things that are quite important as well. And it's also getting your staff trained, making sure that the patient experience is consistent, whether the patient is in touch with administration in your hospital or in touch with the nurses. Anyone who is in touch with an international patient needs to be trained and needs to be certified as well, because that way you're going to, you know, definitely increase the reputation of your hospital. Is going to also increase the satisfaction and the productivity of your staff, because by implementing these processes, you're going to create a more efficient workplace. So let's go into the additional values that our certification brings to the hospital. So as I mentioned before, we can train your hospital and we can certify your hospital. But it is our goal to also make sure that the staff in your hospital is ready, that the staff in your hospital is certified. And one of the benefits of our International Patient Service Certification Program is that we not only certify your hospital, but we also certify your staff, the individuals that are in touch with international patients. So through the training, everyone that gets involved in the training, which is done at your facility, has the opportunity to receive an individual certification, which is called Certified International Patient Specialist. What are the benefits? Well, the benefits of getting this individual certification is to demonstrate the patients, the employers, and the insurance companies, as well as your peers, that you practice high international patient management standards. You're going to set yourself apart from the competition, and you stay up to date with current practices in the international patient services industry. So every person that participates in our training program has the opportunity to access an online educational platform where they can review the materials that are covered during the program, and they can take an exam. Once the exam is passed successfully, these individuals will receive the certification. So it's definitely great value, because as I mentioned, not only the hospital gets certified, but also the individuals get certification. What other benefits does the IPSC program offer for your facility and for your staff? Well, our program includes 2 years of MTA membership with our organization. So what are the benefits? Well, once your hospital has been trained, when it's been certified, we want to make sure as a trade association that we let the world know that you are certified. We want to make sure that we promote your certification through our global distribution channels. So what are other benefits that are included in your membership during those 2 years? Is, well, you're going to receive guaranteed patient and buyer lists during the year. As a trade association, we have the connections with the patients, and we have the connections with the buyers, with the employers, the insurance companies, facilitators. So by being a member of the MTA, you receive guaranteed patient and buyer lists during the year. We will promote your international brand through the communication channels that I presented earlier, and you will also be found very easily through our MTA website searchable feature. People coming to our website can search for our members by geographical area, by industry type, so it is very easy for buyers and for consumers to find you in your particular destination. As a member, you also have access to the network of MTA members, and of course, you'll enjoy access to our resource center with reports on the industry and also special discounts on different medical tourism events. So like I mentioned before, it's very important to understand that once you are certified, you have to continue to promote your brand, and the Medical Tourism Association helps you with the promotion and the visibility through the MTA membership. Now I'm going to turn it over to Mary Miller, who is the Manager of Continuous Quality Improvement for the Medical Tourism Association, and she's going to discuss best practices in international patient certification with you. So, Mary, how are you doing? Hello, Mary.
Hi.
Hi, how are you today?
I'm good. Thank you very much for that introduction. I just want to confirm that everyone can see me and hear me.
Yes, we can hear you and see you.
Okay, wonderful. Thank you. Welcome, everyone. As Christina said, I will dig a little bit deeper into the International Patient Certification Program that the MTA has to offer. Our International Patient Services Program is based on the process of care for a medical tourist. And within this process of care, we identified two distinct cycles, the healthcare patient cycle as well as the hospitality guest cycle, which ultimately has created the medical tourist hospitality cycle. As you follow this diagram, you will see that our International Patient Certification follows the entire experience of a medical tourist and the management of international patients for your institution. So we start with service selection, followed by destination selection, pre-arrival and arrival for the hospitality industry, followed by occupancy, admission for medical, treatment for medical, discharge for medical, follow up with occupancy for hospitality, follow up with medical, departure hospitality, and follow up with hospitality. So you can see that there is a very intimate relationship between the healthcare and hospitality industries for the medical tourist. IPSC certification is ultimately MTA's commitment. We are now on our second edition, which now includes 15 core competencies. It considers core industry priorities, including quality, patient safety, risk management, and staff qualifications. Unique for industry service providers through its competencies in financial standards, marketing standards, customer service standards specific to patient capture and patient retention, travel and tourism standards, as well as cultural competency standards. So many of you may already have some sort of designation, but unique to MTA's International Patient Services Certification is the fact that it is a very refined approach to a certification process, and that is specifically the management of international patients, however they may be defined in your institution. There are common misunderstandings regarding accreditation internationally from an organizational planning standpoint, which can include the length of time to truly prepare for minimum standards compliance, the proportion of work to be accomplished by a third party versus facility staff, the overall cost, facility management requirements, and the requirements of national organizations peripheral to the internal operations of this facility, but directly related to labor management, staff qualifications, resource allocation, supply chain management. And what this really highlights is the fact that the MTA International Patient Services Program is a very specific approach, but it's a scalable approach and a realistic approach to gaining a certification that makes you a more attractive institution for patients quicker, as well as for insurance companies, as opposed to Joint Commission International or Accreditation Canada, which may require a much lengthier time for you to achieve the overall accreditation status. So, and some of these were previously mentioned, but just to go over in detail, our 15 competencies include physical environment, ethics, international patient management, medical assessment and treatment, supply chain management, communication and education, cultural competency, infection control and waste management, travel and tourism, transparency and compliance, financial transactions, patient advocacy, marketing, risk management, and quality improvement. Now, some, and we are prepared to answer this question, may ask, how is this different, or why should I not do or just focus on Joint Commission International or Accreditation Canada? The value in MTA's International Patient Services certification is that it's a refined and scalable approach to you achieving certification in a very timely manner, and something that can serve as an initial stepping stone to you achieving a larger scale accreditation for your entire organization. But this will enable you to quickly improve the management of international patients, increase their satisfaction and their experience, and serve as a catalyst within your organization for larger scale change and improvement. So again, the unique features of MTA's International Patient Services program include a business focus, a marketing focus, a comprehensive understanding of your entire medical tourism product. It's scaled to your international service model, and it has a consideration of industry priorities, including quality, patient safety, and risk management. And when we talk about industry priorities in terms of quality, patient safety, and risk management, we are specifically talking about those topics as they relate to those topics in the context of the international patients that you serve. Our expectations for clients is that it is ultimately a 6 to 9 month process for you achieving certification. We have an initial application followed by training, followed by a survey. And essentially the process follows a baseline milestone followed by you implement recommended training and tools, which some of these tools we will actually provide. And Christina spoke to the value of certification, membership, access to networking, access to educational resources that help you stay current, as well as practical real-time tools that you can immediately put into play. And then once these recommendations are implemented, we then come back and survey you and work with you at that point to help you achieve certification. And just as another point, the recommended training and tools are based on your baseline assessment. So finally, best practice in international patient services involve the inclusion of operational, clinical, financial, and psychosocial aspects of the entire patient experience. IPS should be unique for an individual facility, practice, or clinician as it relates to the patient mix you serve. And embracing IPS principles is critical to the overall long-term return on your investment. Okay, I will now turn it back over to Christina. Thank you.
Thank you very much, Mary, for your presentation. I think we now have a much better understanding of the scope of our International Patient Service Program. How is it going to be valuable for your organization, and what is the process that the program entails? So we really appreciate that insight, and now we are going to interview Alejandro Gutierrez. Alejandro Gutierrez is the marketing manager for Sunny Dental Group. Sunny Dental Group is one of the largest dental clinics in Los Algodones, Baja California, in Mexico. It was originally established in 1985, and since then, Sunny has grown from a 2-chair, 1-dentist office to a 27-dentist group with 2 different offices in Los Algodones. Their staff consists of 27 doctors with different specialties and experience ranging from 5 to 30 years, serving to patients mainly from the United States and Canada. They are graduates from the best universities in Mexico, and they have taken courses in several prestigious institutions such as Harvard School of Dental Medicine in Boston, Massachusetts, and the International Center of Laser Education in Indianapolis, Minnesota. The doctor's team has specialized in laser dentistry, oral surgery, dental implantology, among other specialties. It is my pleasure to introduce Alejandro Gutierrez to you, and I'm gonna start, the interview with him so that you can understand what was the process that Sunny Dental Group went through, and because they got certified in 2013, and we want to know from Alejandro what was their experience firsthand.
Hello, Christina. Hello. Thank you for the introduction. But it's great to be here.
Excellent. Give us just 1 second. We're going to start the interview.
Okay, no worries.
Okay. Okay, so Alejandro, why did you decide to choose the MTA IPSC certification for your organization?
Well, it all started about 1.5 years ago. Sunny Dental Group, being a trade leader in the local market of Los Algodones, we started looking at something that would make Sunny Dental Group stand out from the competition, and at the same time, something that will offer extra value to our patients. So the first thing that came to our mind was to get certified by an international entity. And after looking at different options, we saw something very particular in the International Patient Service Certification by MTA. That's its focus in the service and the whole international experience for patients, not only the medical aspect, in comparison with other certifications we reviewed. So we went for that one. And as you just said, the international patients look online with just one question in their mind: who's going to offer me the best experience and service? So being part of the MTA network puts us one step ahead of other providers in the patient's mind. So, and the other very important reason that we got for it was that the company is making an effort since last year to get new providers and relationships with facilitators to try to get markets that were not yet there. So, especially in appearances like the MTA Summit and other kinds of events like that. So for us, being certified had a double purpose. One was creating confidence in our patients, and other is creating confidence in new facilitators that were interested to work with.
Excellent. Well, thank you so much for your feedback, Alejandro. I wanted to ask you if you could please describe to us how was the training experience, for your team. Sunny Dental Group received training and certification in 2013, and the MTA team traveled to their facilities. So, I would like for you to share with the audience how was the experience for the entire team.
Perfect. Well, the training actually started months before for me. We received the different aspects that the certification was going to review. So we had some time to prepare, and for me and many others involved, that was part of the training experience. That was a very important part of it, to get ready and to get everything and everyone ready for it. That was very important for us. So we received our training in-house by Bill Cook and Gloriela, and of course with your help, Christina. And they came all the way from Costa Rica to talk about different topics. And starting on the medical quality of the international patients, the medical quality the international patients expect. And they went all the way to just talk about the facility, talk about customer service, and they made an on-site inspection first. So the whole training process was very much personalized to our situation and our needs. And every department of the company was involved in the training, and we tried to get as many people as possible with an on-site training, and we got a lot of doctors, assistants, most of them, administrators, directors, and of course everyone involved in customer service. And we were all on the training, and overall it was a very good bonding experience.
Excellent. Well, I'm very glad that the experience was so positive. Can you tell us, what are the takeaways? What were the takeaways from the training?
Well, to be fair, we're located in Los Algodones, and Los Algodones is a weird location. I don't know if anyone in the audience actually knows about Los Algodones, but it's a very weird location compared to other medical tourism destinations, because more than 99% of our patients come from the U.S. and Canada mostly. And that being said, there's of course a lot of people that think they know it all. After dealing with international patients every day for years, there's just a few things that can impress us and impress them. So what I really liked is that the feedback that we got from everyone involved was very good. They were all very satisfied with it. They all thought that they learned something in the process in their respective fields. Even if not everyone likes to accept it. But it was a very good experience, and the leadership team was very pleased with the whole experience. Particularly me, I have to say, being in charge of the customer support department and the marketing department, I think the training was especially useful for us and was good for marketing purposes as well.
Excellent. Thank you so much, Alejandro. So what are the changes that Sunny Dental Group has implemented since the organization went through training? Were there any areas of improvement that they needed attention? What were the what were the changes that were implemented?
Okay. Well, the first thing that comes to mind is are the ones that we implemented in the customer support and marketing department, that being my department. We changed the mailing template. We simplify our responses by email to make it easier to being understood by our market. We got a lot of feedback that way, and we did some changes. We're getting more conversions now from our prospects. After receiving leads, after receiving prospects, we're getting more conversions because of those changes we did. Medically speaking, we changed the files from our patients and added some new formats to offer better services, but also to protect ourselves better. Legally speaking, we added a pre-qualification questionnaire that you recommended, and to detect possible medical conditions in our patients before their appointment. So we had less problems this last year with patients that were not candidates for a certain procedure, and they were already there. So before, it was really common, to have someone, especially for surgeries like implants and everything. If they were taking a certain medication, or if they had a condition, we were not detecting those problems before. So they came all the way from Canada to Los Algodones just to realize that they were not candidates for that treatment. They were really, sad about it and sometimes angry. So we're dealing with no problems like that, just to get that questionnaire. And just to talk about some of the changes we made.
Mm-hmm. Those are great examples, Alejandro, and I think the audience is learning from those particular cases that you're describing. This is a real life experience, and we all learn from each other. So thank you very much for sharing that with us and with the audience. Now, how would you summarize the value of the International Patient Services Certification for Sunny Dental Group? If you could summarize it in one sentence, what would that value be?
Well, I think the International Patient Services Certification offers us huge value, but to put it in simple words, I think it's social proof. I think it gave us social proof in the international market. Sometimes you think because you're the local leader, that everyone has to know about you, and that was something that maybe was not our situation. We were really focused in knowing our place, but sometimes that's a common problem people have. And we're the largest dental clinic in Los Algodones. We have more than 36,000 patients, and 6,000 patients a year this last year. So we're a big clinic, but we have to put that aside and just understand that we're not recognized everywhere. So for us, the certification was social proof in an international market. I think that's the most important thing. As I mentioned before, we were looking for new relationships, and being out there is, because you're out there, being online is just everywhere. So talking about new facilitators from Ireland, for example, they have no idea even where Los Algodones is. And if you say, I'm the best in Los Algodones, I mean, that means nothing. But if you say, have a certification by an international entity of the MTA, that's key.
Fantastic. Well, actually, you just touched on that stamp of credibility that we were talking about earlier, and how important it is for patients and for buyers of healthcare. So that's fantastic feedback. Thank you so much. Now, just to end the interview, Alejandro, would you recommend the program? And if so, why? Why would you recommend the program to other hospitals and other clinics around the world?
Well, of course, I will recommend the program for those who are ready for it. If not, it's a great way. I mean, just being in touch with the MTA and know what the certification is about, it's a great way to start, get ready to that point. I think this program is perfect for those looking to improve their expertise and the expertise in the organization to receive international patients. You sometimes think you're the best, and you realize that you have a lot of weak points, and you have to work on them. And I think it's also great for those hospitals and clinics looking to expand their market. If you're looking to get into the market, you need someone to back you up. And I think to get international recognition, that I think that I will strongly recommend to get certified. And I think it's a really, again, social proof of your work.
Excellent. Well, thank you so much, Alejandro, for sharing your experience with us. I think it is very valuable for everyone listening to this webcast, and we thank you again. For those of you who don't know where Los Algodones is located, it is in Baja California, very close to the border with the United States. And Sunny Dental Group, as I mentioned, got certified in 2013 and is a proud member of the MTA. So thank you again, Alejandro, for joining us today. And we will continue with our presentation, and we hope to have you back in another webcast soon.
Perfect. Thank you, Christina.
My pleasure. All right. So I would like to continue. I would like to continue talking a little bit about the annual conference that the Medical Tourism Association organizes. Because for those of you who want to learn more about this program, and for those of you who want to network with other stakeholders in the industry, this is an event that you cannot miss. It is the largest in the medical tourism industry. We're going to welcome up to 3,000 participants from around the world. And the next edition of the Congress is coming up next September, September 20 to the 24th in Washington, D.C. I would like to share with you who attend this conference. Well, you see all the stakeholders represented in the event. We bring government organizations, medical tourism facilitators, healthcare providers from around the world, employers, insurance companies. So this is the perfect platform for providers of healthcare to network with buyers of healthcare. As a matter of fact, this is the first year that we are guaranteeing networking meetings for our exhibitors and sponsors, as well as members of the MTA, because we understand it is critical to really get to know the people that you want to do business with. And face-to-face meetings are extremely valuable and much more effective than business done via email or via phone. So some of the event highlights are also going to include the executive summits that we will host during our conference. And we'll have our Ministerial Summit, which is a gathering of ministers of tourism, health, and economy around the world, as well as our Medical Director Summit, which welcomes CEOs and medical directors from hospitals, from international hospitals, as well as insurance companies. And finally, we'll have our Women Leadership Summit, which welcomes women in leadership positions both in the healthcare industry and insurance industry. In addition to that, we'll have different industry forums because we understand each stakeholder has different interests in the industry, and we will facilitate those forums for people to discuss specific topics. So again, the platform to connect with any other stakeholder in the industry, the platform to connect with buyers of healthcare that will, potentially send patients to your facility or to your destination. The value of this event is that we are integrated with the Employer, Healthcare, and Benefits Congress. And this event is bringing, larger employers in the U.S. as well as international insurance companies and healthcare professionals not only from the U.S., but from different parts of the world. So I would like to invite you to participate in this event. Again, it's September 20 to the 24th in Washington, D.C., and we hope that you can join us. Now we're going to dedicate a few minutes for those of you who have submitted questions. Thank you so much for your feedback. We're going to address a couple of questions that some of the participants have typed in the question and answer section. One of the participants was asking about the Certified International Patient Specialist, which is the certification that I discussed with you for individuals. Now, her question was, do you have to work for a hospital, or can persons become certified that are not employed by a hospital? Okay, well, very good question. Thank you very much. This particular program is only for individuals that work with for hospitals that go through the training and certification program, IPSC. So if a hospital undergoes this training and certification, the individuals that take part of this training will get the individual certification. However, if you are not a doctor or you don't work for a hospital right now and you still want to become certified in the industry, we also have an individual certification program, which is called Certified Medical Tourism Professional. And this is precisely for individuals that would like to learn best practices in the industry. And I will be very glad to share this information with all participants. We have another question, and this is a doctor from Europe. His question is, I'm a dentist in Europe. What training did you do with MTA? What type of trainings? Well, this program is offered to all healthcare providers and specialty clinics around the world. So this is not limited for any geographical area. Any hospital or dental clinic can go through this program, and they can go through the training and the certification. So it is also for dental clinics, for plastic surgery clinics. Any specialty clinic will benefit from this program. So if there is another question from a person in the audience. Her name is Adriana Galvez, and her question is, we are a big organization, and I would like to know if we can get individual certification, or does the organization need to be affiliated as a whole? Thank you, Adriana, for your question. That is, very, very good question. Well, as I mentioned, this training and certification program is designed for small organizations and large organizations. It's actually customized to the size and the needs of your organization. And the hospital does not have to be affiliated with the MTA in order to benefit from this program. But by going through this program, they'll receive MTA membership for free during 2 years. So again, not only the facility gets certified, but it's also the individuals that go through the training that get individual certification. There is a question about clinic quality and patient safety. I would like Mary Miller to answer this question. And the question is, what kind of specific measures do you use for clinic quality and patient safety? Mary, would you be so kind to address this question?
Okay, there we go.
Okay.
Hi, thank you.
Mm-hmm.
Yes, just to be clear, the question was, what specific safety and quality indicators do we reference within our certification program? Is that correct?
Yes, specifically, what kind of specific measures do you use for clinic quality and patient safety? Mm-hmm.
Okay, so in addition to our International Patient Services Manual, we have a survey process guide which details that, in addition to a KPI manual. In general, we do reference industry best practices related to these metrics, such as length of stay, international patient safety goals, patient satisfaction. But what we also do is have or gain a unique understanding of where you are from a developmental standpoint. And part of our certification process is that on an annual basis that you report at least 3 indicators that we have identified from the beginning of our relationship. So part of our version 2 of our certification program is that there's an annual KPI reporting feature that is unique to your developmental gains, but also within the context of the indicators that we recommend that you track for management of international services. So there's a number of indicators, but they are traditional in the sense of common safety, satisfaction, risk mitigation standards or indicators that you may already do or that we may suggest to ensure that you are continuously improving.
Thank you, Mary. Thank you very much.
You're welcome.
Okay, so if we don't have any more questions, I would like to close this webcast today. We would make available the PowerPoint to everyone who joined us today, and also if you would like to ask more questions, we would be very happy to respond to your questions. I can centralize those questions. You have my email address, Christina@medicaltourismassociation.com, and please send me any questions regarding the program, how to get certified, how does the training work, and we will be very happy to respond to you after the webcast. And thank you so much. Thank you so much for your time. I know that you're joining us from different parts of the world, and it is our pleasure to really share this time with you. We hope you have enjoyed the webcast, and we also hope that you found the content valuable to your organization. Thank you so much, and hope to see you soon in our next webcast. Bye-bye.